collaborative work which examines the socio-economic determinants of climate change impacts on health systems in Tanzania. It is a comparative of 4 study sites, and this project is prepared this research has been prepared under the project of health system research responding to climate change in Tanzania, which is being funded by the WHO. So climate change is a significant global challenge with far-reaching consequences for human health, causing increased disease transmission, affecting food security, mental health impacts, and so forth. And Tanzania, as a developing country, is particularly vulnerable to the adverse effects of climate change due to its dependence on climate-sensitive sectors such as agriculture, fisheries, tourism. It's also limited adaptive capacity to climate change impacts, geographic location, poverty, inequality, and so forth. So this study investigates the socio-economic factors that exacerbate or intensify the impact of climate change on health systems in 4 study sites in Tanzania. And this research aims to identify the key vulnerabilities, explore the relationship between these socio-economic factors and related health outcomes, and also propose strategies to inform policy and decision-making to build resilience of the population. The methodology, we employed a qualitative case study design with a comparative approach of the mentioned 4 study sites, of the 4 study sites which are Kilosa District, Same District, Temeke Municipality, and Babati Town Councils, which have been chosen based on their documented vulnerability to climate change impacts. And we also employed purposive sampling of key informants and community members who were knowledgeable about the subject matter, and we did in-depth interviews. The methods of data collection included in-depth interviews and focus group discussions, and the data were analyzed based on the thematic analysis based on the WHO Health Vulnerability Framework of 2023. The key findings in the 4 studied sites included, it was noted that inadequate infrastructure in all the 4 studied sites, there has been noted the presence of inadequate infrastructure such as poor sanitation and transportation, which hinders access to healthcare and increases vulnerability to climate-related diseases. Also, in all the 4 studied sites, it has been noted that poverty and inequality has been limiting access to essential services, while inequality has been exacerbating disparities in health outcomes because of these marginalized groups not being all being easily accessible. Another outcome, it was noted that education and awareness has also been one of the socio-economic factor that impacts climate change and exacerbating the impacts of climate change on these health systems, whereby low health literacy and limited understanding of climate change has been hindering effective adaptation and mitigation efforts in all the 4 studied sites. Also, there is an issue of poor governance, whereby weak governance and corruption has been noted to hinder the implementation of effective climate policies and hinder resource allocation for adaptation and mitigation of the impacts of climate change in the studied sites. Also, it has been noted that another factor is the social and cultural factor, whereby the traditional practices, the gender roles, and the social norms have been noted to influence vulnerability and access to health care of the population in these 4 studied sites. Another one is the pastoral conflict. This has been noted in one of the studied sites, which is Kilosa District, whereby climate-induced resource scarcity have been noted to lead to conflicts disrupting health services and displacing communities. For example, if you can remember, in 2009, there was occurrence of what we called Kilosa killings, whereby there was a conflict between the pastoralists and the farmers over the feeding grounds, and especially the resource that was really lacking and led to conflict. It was water, inadequate availability of water resource. Also, inadequate funding is one of the factors that was noted in Kilosa, whereby limited funding has been noted to hinder climate change adaptation and mitigation efforts, including those related to health, like also issues like funding the training of health workers or health worker capacity in certain health facilities and so forth. So this study there are key climate change impacts on health that has been noted, which include increased disease burden, especially waterborne diseases, vector-borne diseases like malaria and dengue, and respiratory illnesses. Also, malnutrition and food security, whereby it has caused reduced agricultural productivity, food shortages, and malnutrition. Also, mental health issues as one of the key climate change impacts, whereby it has caused stress, anxiety, and depression due to climate-related disasters and displacement, as well as heat-related illnesses such as heart stroke and other heat-related health problems. Therefore, this study highlights the significant impact of socioeconomic factors on the vulnerability of health systems to climate change in Tanzania, and it has come up with several key recommendations. One is to strengthen the health systems, that is to invest in infrastructure, the workforce, and emergency preparedness of the health systems. To also address socioeconomic inequalities or disparities by reducing poverty and inequality in the studied sites. Also to promote climate change education and awareness, to raise the awareness to reduce health illiteracy in the studied sites. To also strengthen governments and policy, whereby it is recommending that we implement effective climate change policies and try as much as possible to end corruption. Also to build community resilience, whereby it is really important to empower communities so that they can be able to adapt. To also invest in sustainable infrastructure, whereby it is important to develop climate resilient infrastructure that can sustain in the times of impacts of climate change, when climate change hits hard. To also integrate climate change into health planning by incorporating climate change into health plans from the very beginning stage. Thank you.
Thank you. I'm presenting the climate action in health facilities across 3 sites in Tanzania. And as my fellow presented, this is the same project that she took part, but the difference is I didn't have case for Dar es Salaam, but other 3 cases were relevant. Why is it important to look at climate action in health facilities? It is because climate change impact on health is one of the greatest challenges that affects public health, and we know healthcare facilities are not immune from those impacts, as both their operations and population they serve are also affected by the climate change impact. We also know it is important because healthcare facilities contribute to the greenhouse gas emissions, especially in energy use, if they use fossil fuels, and also the entire supply chain in health facilities. For example, it can involve emission from pharmaceutical, transportation, and even procurement may also contribute to greenhouse gas emissions. However, the good news that we have is that health facilities also have opportunities for adaptation and mitigation of the climate change impacts. Scholars have identified different ways over which health facilities can adapt and mitigate climate change impacts. And some of the ways is, for example, the use of creative waste management and energy-saving techniques. Others insist of use of clean energy and also sustainable operating rooms. Others also talk about sustainable procurement guidelines in order to reduce greenhouse gas